Today I'm joined by Dr. Tim Pearce, a highly respected medical aesthetic doctor, educator and advocate for safe and ethical cosmetic treatments based in the UK. With over a decade of experience in aesthetics, Tim has become a trusted voice in the industry, known for his commitment to patient safety and education. As the founder of SkinViva, he has trained thousands of healthcare professionals in the art and science of injectables, emphasizing the importance of skill, precision, and a patient-centered approach. So if you've never had any cosmetic treatments before, what should you look for when choosing a practitioner? Why is a facial assessment so important before jumping straight into injectables? The aesthetic journey is constantly evolving, and we also unpack Tim's thoughts on some of the newer treatments, including exosomes and Redurin, and the future of the industry in general. Let's get into it. Dr. Tim Pearce, I'm delighted to welcome you to the podcast. Thank you for coming on today.
It's a pleasure. I'm very pleased to be here. It sounds like an excellent thing you've got going on.
Tim, I would love to start with you sharing a little bit about your journey into aesthetics and how you made that decision. I know that some of our audience will know you, but some won't. And I'd love if you could share, your journey and how it's evolved over time.
I often think about the people who say things like, I really wanted to blend art and science, but that wasn't why it started. I was working in the NHS. I could see that I was not going to have any autonomy. I'm a very creative person, so I would come up with ideas to try and solve problems in departments and systems of communication. I would enter like the junior doctor's Dragon Den thing, which was an idea to get investment, and then they would say it was a brilliant idea, but they still weren't going to, like, no one got the investment. It's really funny. They got all the ideas, but then no one changed. And then it was over really bad stuff, like actually that the idea came from, which is I could see the clinicians were not communicating with each other about basically subpar management plans, only minor things, but there wasn't a feedback loop, and there was quite an authority-driven culture in the department I was in. So whoever was the boss would dictate everything. And I was like, we need a system to get people saying out loud what they say in the restroom behind afterwards. And so I came up with this system. Anyway, it was a flat no one, and it was a turning point for me, because I remember thinking, I don't think I want to be stuck in a place where I can't create things the way I want to create them. And then the trigger was that I also was on a banding system. So essentially I had a big drop in pay when I'd already bought a house. I needed to, I would have had to have done something. So aesthetics just felt like maybe I can have my autonomy and a bit more cash. And even if it just ties me over before I become whatever it was I wanted to be in those days. I think it might have been an orthopedic surgeon, which I don't think would have fitted. But, and then in that situation, I suddenly realized it was a different thing. And I started to feel very differently about it. In fact, it was one of my first patients, which was a 92-year-old lady who I immediately thought, what am I going to do to make a 92-year-old lady look younger? Like, even if I take 5 years off, no one's going to be able to tell. And then she told me this amazing story about why she wanted Botox was because she was very lonely, and she used to catch the bus. And when she was on the bus, she wanted to talk to people, but she felt like she looked very grumpy and the people wouldn't want to approach her. So by removing her frown, her ability to frown, she felt she'd be more approachable, or she could approach other people. And that was the best patient I ever had, because I suddenly realized, oh, this isn't about appearance. It's about social connection. It's about humans connecting with each other. And your appearance is one of the very important ways that people connect. And I'm just prolonging the power of someone to be able to connect in their life by making them look younger or better looking. And a lot of it's internal, but some of it is outside as well. I think someone who is frowning is less approachable. And so that was the turning point where I suddenly realized, actually, this is, at least I can make this part of the overall health and well-being of my patients. And I've been kind of getting better at that and trying to teach that for many years since.
Yeah, I think interestingly, sometimes my patients so I work one day as a GP still, and I know that I love my patients, but they're a little bit grumpy at me sometimes because they perceive that I spend more time at my other clinics, which is true. And a few of them have said to me, "Oh, Oh, you seem to be spending a lot of time at your beauty clinic. I always say it's actually not a beauty clinic, but it's a confidence clinic, because actually that's, I think, the fundamental thing that we're doing by, fixing up someone's skin, or, as you say, taking someone's frown line. Because I've so many women come in and tell me that, they maybe work in an office and people come in and constantly ask them, what's wrong? Why are you in a bad mood? And they're not in a bad mood. They just do have a frown line. So, and it really does get to people whenever people are commenting on their looks all the time. And you and I both know that you can actually really transform how someone feels actually by just giving them more confidence. So I love that.
The thing, if you don't mind me taking it, because I used to also just think it was about the feeling, and it's enough, because people feel great, they hug you, they cry, they're gone, and you feel like you've done it enough. But what I've been increasingly interested in is, what do they do with that confidence? Because that's when it really becomes powerful. Because I always teach clinicians to ask patients where the friction points are, like, where is this wrinkle affecting your life? Where do other people come in and say, oh, you look tired when you're not tired? So they're not listening to you, they're thinking about your face, kind of thing. What happens when you have got rid of that? Because often, my working theory of people is that we often are only semi-conscious about what we're doing. So you hate the wrinkle, you feel you lack confidence, but you haven't really asked yourselves the question about, what will you do if that wrinkle is gone? And often you get amazing stories of, well, I suppose maybe I'd go dating again. Maybe I would apply for a promotion. Maybe I would, go back to the gym, start dancing again. I mean, these are all real things that I've heard people say in the last year. And then, like, you can sometimes catch them in that moment. So I had a patient who it sounds ridiculous, but he's in his 30s, and he said he felt like he was getting old now, and he had these under eye circles, and he had going to the gym lately, kind of feeling like he was over the hill. And then anyway, we fixed all of that. And the next time we contacted him, he was literally in the gym again, working out, feeling great again. And so he was actually doing the thing. And so I try and go beyond the confidence to what would you do? And then you can see real health impact. And that's why calling it a beauty clinic is the feeling you have, which is, it's so much more than that, is so true, because these people are out there living a different life because they feel better. And I think patients who don't get it, I mean, my own family don't get it, so, but you have to just put up with that, do your consultation right, and then see your patients living a better life, and realize that it's all part of one thing: health, longevity, and aesthetics. In my mind, if you do it right, it's all part of one thing.
Yeah, absolutely, 100%. And so after you started into aesthetics, how have things evolved from those very, very early days, when I know that you were kind of working out of various different salons and clinics? What have you seen evolve over that period of time?
Well, some things have changed, some things have stayed the same. The UK is a crazy situation because there's no regulation. So the industry in the UK is a wild west of people training other people who train other people, and none of which have got medical qualifications. So we've recently had a high-profile death. There have actually been more. I was talking to a Daily Mirror journalist yesterday, and she mentioned one I hadn't heard of before. So sometimes I don't hit the news for whatever reason. But we had someone having a BBL injection in a kitchen somewhere that got a DVT and a PE, died. That has been the same the whole way through my career, but it's getting worse. So they used to just do a little bit of Botox, and now it's full liposuction in your kitchen type thing. So we have that problem. At least you guys don't have that. That has just got worse. In terms of the good things about the industry, I do think it's amazing how it's changed from treating nasolabial folds, which I didn't even know what they were when I first started aesthetics. I always tell that story because I was like, why is that a bad thing to have a shadow there? I hadn't figured out how it connects with how you perceive someone. But we've gone from that to doing just insanely effective things that last a very long time. Sometimes that's not good, but usually it is good if you don't have problems, that really make an impact for relatively little downtime and risk. So I think it's been predominantly a good development.
I think the trends have definitely changed. Obviously, we live here in Australia, and I've always liked a very, very natural look personally. I don't like that kind of done look, and I do believe that there's a very big but quiet majority of people who are quite scared of looking strange and funny, and they, are frightened by the things that they see on social media. And, I know even initially when I went to a few conferences, 7 or 8 years ago, even I was kind of at the conferences looking at colleagues going, whoa, like this is, it was like people had taken things to a real extreme. Has the trend flopped back a bit in the UK where people are looking at a much more natural look and people having filler dissolved and things?
You do hear that. It's like a lot of trends. I think on the periphery, that's true. And then there's a central core who haven't caught up with that yet. Now, I've recently been trying to treat patients who I don't normally treat. So because we teach other people, I've been searching for, there's different avatars of patient that we understand. I mean, obviously it's a gross oversimplification of humanity, but it helps you in your consultation to think about how people present. And we have the psychotype called belle of the ball, which is they're extremely positive, don't care about complications at all. They want to stand out. Everything's already done, and they want to stand out and feel more beautiful and get more attention. And by the way, I had zero judgment about this. I think it's survival. Essentially, if you get attention, you get the most opportunity to choose who to collaborate with and who to build a life with. And it feels like a fun kind of hobby, but it's based on certainly, well, there are male and females who do this in different ways, but it's based on a survival mechanism. So there's no judgment in it, but it's very different to what my normal patient, we call her, what do we call her? Restoration Rachel. So Restoration Rachel is very much around, please don't make me look done, tiny tweaks, open to everything, but they've often done their research. They know lots of things. They use some of the lingo, but they're very hard to get to make progress because everything's a potential risk. So they require good consultations and a trusting practitioner. And you're probably attracting similar types from what you said.
Curious but cautious, I call them.
So and I found it hilarious going back to treating some of my belle of the ball patients, because I've forgotten what it's like, because I have such a concentration now of these cautious, reflective, wiser, older people, that the belle of the ball psychotype is totally different. They're like, I want to see a result. And have you got, I don't know if you've ever had this, but they watch how much is in the syringe while you're moving around. And I used to think, don't worry, I'm not going to over-treat you. And they're like, no, I'm just making sure you put every drop of that in. And it's just very different. So you also have to consult them well and keep the brakes on appropriately. But it just made me, it amuses me to think about how different these parts of the Instagram are. And we talk about stuff, but behind the scenes, people are, they're just doing their own thing in many ways. But the trend there is definitely trends that are changing, but I still think there's a hard core that are going to remain no matter what you do. And there's very little to beat the quick effect you can get with filler. And if you haven't got a chin and tomorrow you have got one, you want that. And the same with lips. So I think we talk about it like it's all over, but it's just a vague shift for a while, and then we'll go back the other way. But I'm glad that there's more discussion on looking natural, because I do think a lot of people cause a social disconnection by overtreatment, and that's the real injury. People no longer listen to them. They think, oh, that girl with the big lips, rather than, whatever her name actually is. I class that as a social injury that you've caused. So you need a good clinician to guide you not to cause those problems.
Tim, I'd love to take a step back, because some of the patients that I see, and I know that many of them who will be listening actually are quite uneducated. They even struggle with what is the difference between, wrinkle reduction injections versus dermal fillers. Would you be able to explain what those are and why you might pick one or the other or both?
So in terms of muscle relaxants, botulinum toxin, you're relaxing the muscle that causes the wrinkle, and you're relaxing the muscle that pulls the facial feature downwards if you want it to go up. So you can subtly affect the resting position of certain features. It's mainly eyebrows, but the corner of your mouth, and some of the dynamic attributes. So the way your face moves can be improved by relaxing certain muscles, and that's done with a protein that essentially temporarily disrupts the message that comes from your nervous system to the muscle to cause it to contract. And that then allows the skin to recover, for wrinkles to soften, and it allows certain facial features to alter position, because untreated muscles subtly pull features in the opposite direction when you've treated the treated muscle that's in pulling in the other direction. That's essentially how that works. It takes 3 to 4 months. You might be lucky and get longer. Sometimes you get a bit less. But the result, it's very, very safe. All the side effects are temporary. And as long as you buy products from reputable places, you will get scare stories of people getting botulism, but they tend to be, shopping from strange places rather than directly from the manufacturer, which is what I always recommend a good clinician does, or one of the big pharmacies. In terms of dermal filler, there are all sorts of dermal fillers, and it's worth reflecting on which ones you're getting, because they all have different pros and cons. I'm a very cautious practitioner who likes the ability to go back from where I am, so I only use reversible products. But there are some attributes that are some reasons why you might use a reversible product in some people. And essentially, what a dermal filler does is mostly you can use them at multiple different layers of the skin, and they can soften wrinkles, they can alter the contour and the shape, and they can replace volume. And to a very small degree, I believe they can cause a small lift, or at least a strong appearance of the word of lifting. And so you can instantly look fresher, younger, and more beautiful if it's done well. But it's very artistic. It's not so much about the product. The product's important, but you also need to have someone who's taking your face and the whole context into consideration in order for you to get a good result. And most people have it. They get many years of benefit over time, but it needs to be considered as a long-term thing where you're making adjustments according to what you see every 12 months or so, and not just going to different places. You just put more in. You need to be taking that overall approach. Otherwise, you will end up looking, if not overtreated, just slightly odd, because it's sculpting, essentially. It's sculpting a moving target, because you also don't lose the volume in the same way, in the same places. So that's essentially it.
Yeah, no, that's great. And what's your thought on the migration of filler? Is that something that you think happens? Does it go on the move?
I think the bulk of what you see is more diffusion. So if you inject a product, and I do think there's big differences between products, but I can't tell you which. Unfortunately, it's not very well researched, and also some people respond differently. But if you inject a line of filler, it's a bit like putting tea bag into your tea. It slightly, even if you don't stir it, it will spread out slowly, but it doesn't kind of go traveling around to different places. Certain areas with high volumes, you see collections of product. So if you have your lips treated again and again without respect to the previous treatment, you might start to notice that some areas it gets squeezed out of, and other areas it remains, and you just end up with a slightly distorted appearance. I think it happens anywhere where there's lots of movement. It's not quite the same thing as just I think migration sounds like it's literally crossing borders, going into new places, and I don't think it's quite as strong as that, but it's enough that in high sensitivity areas, particularly around the corner of your lips, you can see it. So that's the biggest area I think people talk about it. Tear trough is the other one. But if you look closely at people's faces, I saw a chap who'd had his nose done 6 years ago recently, and it was still better than how he started, but it also started to expand instead of shrink. So his nasal bridge was just slightly fuller than the picture that I had when I first treated him. And as long as you're open and honest and talk about it, it's very easy to solve. So that you just need a way out of it. But it's more of what I'm basically saying is it hadn't moved to another part of his face. It had just expanded. And I think that's what you're dealing with most of the time. And you want a product that you can reverse for that reason, and a product and a clinician who's paying attention to all of that. And it's an adjustment every few years normally that you need, not like every 3 months. You have to reverse it.
And is there any types of patients that you think should absolutely never have dermal filler?
Well, first comes to mind are the kind of psychological attributes. So some people, they're essentially trying to solve much bigger problems with a distraction. I don't know. I remember breaking up with my girlfriend when I was 18, and I immediately started to grow a goatee. Let's see if I could grow a beard. I couldn't at that age, but I remember thinking, I've always thought of that like it was a distraction. I was trying not to think about the pain I was in by doing something so that I could think about that instead. I think some people, there's a wrong time to do it. Maybe the right treatment, but the wrong time. And some people, they essentially are never going to be made happy by the treatment. That's how I consider body dysmorphia. Is it doesn't matter what you do, you never get the relief that the patient thinks they're going to get, and in fact, it can make them worse. So that, and I think it's a bit harder in practice than with the questionnaires to decide who's got body dysmorphia. But essentially, the acid test is, do they look better but feel the same or feel worse? Then I would never treat them again. And if they've had that experience in the past, I would have a conversation about whether this is the right avenue to look to actually provide them with the relief that they want. But it's tricky. That would be the main one. The other one would be acute times of your life is not a good time. So recent deaths, breakups, all those kind of things. But there is a period, I just also want to say, like a bit beyond that, where it's actually quite healthy. Like you've had a divorce, you've been miserable for 8 months. You're starting to feel a bit better, and you're thinking about going out more. That's actually often the perfect. You're on the front foot again. You're trying to restore things. So that's a bit different. I don't want to put everyone off because there usually is a trigger. You just don't want it to be too acute. And then there's some physical things, but very few of them. So mainly it's any time when you have a lot of medical uncertainty, then it's probably a bad time. So if you're going in for surgery next week, probably not a good time. If you have an autoimmune disease that's inflamed or has been inflamed 2 months before, and you're hoping it's okay, but it's it's a bit touch and go, probably not a good time. But I would say Botox is quite simple, but similarly, if you're very worried about things, I'll give you a story to bring it alive. I had a patient who was incredibly worried about blindness from dermal filler, and generally it turned out. And I took dermal filler off the table, and then we decided Botox would be easier. She was still anxious, but I'm very, very good at reassuring people. So I give all the explanations. I come across as calm. I got her through to the point where we could do one area of Botox, thinking that's not going to cause any problems. And anyway, she had her treatment, took one step outside the clinic, called an ambulance, and went to the eye hospital because she was so anxious about her eyes. So in retrospect, I shouldn't have treated her because she was so anxious. I was making a rational assessment that this is not a risk, so I can do it. But her emotional state was so bad that she ended up in hospital anyway. I mean, she obviously got discharged because there's nothing wrong with her, but except for anxiety. But that would be another thing. Like, don't do it when things are chaotic in your life.
Yeah, absolutely. And Tim, I know that you're very passionate about having a thorough facial assessment before you would progress with a treatment. What does that look like for you, and why do you take that approach?
So, I mean, the biggest difference with me is I think the facial assessment is just one of the diagnoses that we make. So I want to know what the patient's story is. I want to know where the friction point is in their life, and I want to hear the things that they say to themselves and the things that people say to them, because only with that can I actually do a proper facial assessment, because you're trying to relate what you see to a social friction, which is people say I look tired, or it's like whatever the term, doesn't really matter. But then I have the context to look and diagnose what it is on the face that's causing that social disconnection. So in terms of what I do then, I think some clinicians, it's quite hard to listen to. They describe it, and some hairdressers do this as well. I've seen more hairdressers myself than clinicians, because all my clinicians who I've trained would never do this. But the hairdressers, I don't know if you've had this, they kind of pick your hair up and they go, oh, what shampoo do you use? That's terrible. And who cut this last? It's always like, so some people do that with faces, and they'll say, this jowl, you're going to have to do something about that. And you've got this deep shadow under your eye, and that's going to need fixing. And it sounds hard to listen to. So I try and make my facial assessment pleasant and empowering. So you would normally start with a compliment, like what is actually good? And there's always something good. And then I give them some education on what a healthy, happy face looks like. So we talk about framing and projecting points, and why, I'll use a good asset often and say, you have beautiful details around your lips, or your eyebrows frame your eyes nicely. And this all that you're essentially trying to educate them on what a healthy feminine or a healthy masculine face looks like, which then gives them context to hear the opportunities to improve it. And I'll ask for permission multiple times. So once I've given them I call it Aesthetics 101, I'll say, is it okay if I actually talk you through the areas of potential that I think you could make little tweaks? And then I give them permission to reject everything and anything that I say, because I want them to feel in control. So I will say, Now, I might be able to correct something, but I want you to feel like it will make you feel better before we do it. And if anything I say to you sounds interesting, but you don't get why it's going to make you feel better, then we'll just take it off the table. So there's a constant invitation to remove things. And I will also do the same when I'm assessing. I'll say, you do have a tiny wrinkle there, but I know enough about you, if I know their budget or their goals, to say we should just ignore that, because that's not really going to make you happy to get rid of that. So I'll actively take things off the table when I think is appropriate as well. And this is just trust building. And then then we can systematically go through the face, and I'll look at the top third, middle third, and lower third. And I also divide it into quadrants. Sorry, I don't ignore the most lateral, the middle, and obviously the central component. A lot of people forget to assess the nose, for example. So I always say divide it into 9s, systematically describe the good things and the opportunities for improvement, and then piece it all together at the end with many opportunities for the patient to feel like because the patient fears it's a trap, that they're going to be told they have to have everything you've mentioned. So I'm constantly saying it's just an overall assessment, and then we'll decide at the end what's going to make you happy. And I think that's important. Otherwise, either you end up spending money on things you don't really want and risk, which is the worst bit, or they get defensive and don't have anything and go away and think about it when they actually wanted something. So it's important to make people feel safe and cared for while you describe all these details. In terms of how I describe it, I'm using a framework now where I describe the defining points. So every face, if you have a look at a face, it's defined often by the hairline. And then there are certain key points. So eyebrows, position the apex of your cheek, the apex of your chin, obviously the shape of your lips and the projection of your nose, your jawline, your gonial angle. And you can work through each of those defining points, and then they're also connected together. So your chin is connected to your gonial angle, your cheek is connected to the also by a line that runs to oral commissure, and you can use those lines and projections, and then there are surfaces that connect the lines together. So I will describe it in that way, particularly to clinicians more than patients, but so that they understand I'm creating a 3-dimensional structure that we're trying to make beautiful and resonate with other people's brains and their brains as the right shape for a human face, which is essentially what we're trying to create.
Okay, ladies, get your diaries out and mark the date. On the weekend of Friday the 30th of May to Sunday the 1st of June, I'm inviting you to join me at the Quarters in Foresters Beach for our first ever She Thrives retreat. Designed exclusively for women aged 35 to 60, experience expert-led workshops, yoga, luxurious wellness treatments, and access to premium facilities with saunas, cold plunge, and more. Enjoy gourmet meals, fun evening entertainment, and take home a goodie bag worth over $500 while connecting with like-minded women. To learn more, head to you.drshaunaWatts.com.au. I hope to see you there. Obviously, you're really passionate about education, and I know that from taking a lot of your online courses myself, you've gone to great lengths and probably huge expense to create sort of 3D models. Is that because you saw clinicians making repeated mistakes, thinking more in 2D rather than 3D, or what was your thinking behind that?
Yeah, so it comes from me trying to describe things and feeling frustrated. So, and also being wrong sometimes. So and some of the debates around how to inject that happen in our industry, they're essentially just debating two different perspectives of the same thing. And so increasingly I became aware that a lot of the studies that talk about injection depth or angles or, what is safe and what is not, they're just all wrong because they're talking about a 2-dimensional shape. They're talking about it from one angle. They're right, but only if you looked at it from one angle. As soon as you rotate it, it's like, well, that doesn't apply anymore. So it came from that, trying to capture those ideas. I initially started editing my own videos, and I'd spent ages I just didn't know how to do 3D. I didn't know what the tool was. So I'd be trying to edit in video and trying to capture this and get increasingly frustrated. And then I came across this 3D tool, and I was like, this is insane. I need to try and capture this in 3D. So it comes from a desperation of not being able to communicate what I was imagining and seeing this confusion and just wanting to explain explain it better using something that you could actually understand more in the structure it actually was. So yeah, that was the main driver.
And do you think that that way of approaching it is going to improve patient safety?
Yeah, I think the biggest difference that happens between new injectors and experienced good injectors is the resolution of their anatomy and their thinking. So I know this for myself. I like to be open about my former shortcomings because I know everyone goes through this. We just pretend sometimes that we don't. But I used to get horrendous bruising on patients, particularly with lips. I remember hating lips because like, oh, they just bruise terribly, don't they? Well, they don't anymore. Like, what's happened? I'd still, to the untrained eye, looks pretty similar. I'm still doing a horizontal injection, but the difference was 2 or 3 millimeters of depth, which to the untrained eye doesn't look like anything. To me, now it looks really obvious. But you have to develop that resolution in order to get your needles basically in exactly the right plane where you're less likely to get as much bruising. So, and I think the same with risk, the angles, depth, positions, the more you understand the anatomy and you're more precise with your injection technique, the better your aesthetic results because your filler is actually where you want it to be, but also the safer you are and the less side effects that you get.
Yeah, amazing. And whenever I went into aesthetics, one of the things that I wanted to do differently was sort of take a bit more of a holistic approach to the patient. So, like you've been a doctor for a long time, and I knew that I'd accumulated lots of knowledge in terms of lifestyle medicine, and I'd done my lifestyle medicine exams from the US and things. But I also knew that lifestyle was playing a part in people's appearance in terms of their nutrition and their sleep and their exercise and whether they were getting enough sleep. And I've always tried to incorporate that into my clinic, and now I am, incorporating peri and postmenopausal care because it's just also interconnected. And I know that you also take a similar approach, but you've also been very interested recently in the link between longevity and that anti-aging piece that's really sort of taking hold within medicine and all the huge amount of research that's going on there. I'd love you to tell us a little bit about where your explorations have taken you on that journey and what you're loving using with your patients.
I think the whole time in my career, I always look for a deeper purpose. Because the 90-year-old lady that I saw was really the start of me thinking differently. But the earlier patients, I remember thinking I'm getting rid of wrinkles. In fact, I remember I gave my brother some money once after my first patient. They paid me cash, and I said it's sponsored by Wrinklies. I felt guilty about that statement ever after. I've never. I was trying to make a joke, and you don't always see this online, but I do have a sense of humor that it's. I mean, I think it's funny, but it can be a little bit jolting sometimes. And anyway, I felt guilty about it, but it was because I'd seen it too simply. And what I love about longevity is I feel like aesthetics and longevity, you can really get to some super valuable stuff. Like imagine being partly responsible for delaying the onset of a terrible illness by 10 or 15 years. And imagine the benefit. I mean, it'll be like a lot of the best things that you won't actually notice. It'll just be that life carries on better. But I feel like that's a tremendously valuable thing to be involved in. And obviously in general practice, you try and do it. But at the same time, it's very different at least in the UK, being on the pro health side versus the NHS. And I still practice as an NHS GP. I just don't, you're very reactive. And I can't really spend 2 hours with a patient and figure out how their relationship with food is affecting their weight and how, their relationships are affecting their stress levels. They're making them not sleep well and all that stuff that you could go into. You have more detail. And I'm really excited by the fact that I think, firstly, we're learning to do much more with the human body. I just checked my heart rate variability, which I touched on, is now it's like 150% what it used to be about 2 years ago. And that's just through changes that I've been implementing myself. And I'm really excited by the fact that I'm getting personal results and I want to pass them on. I want everyone to benefit from all the things that I'm learning. And I feel like aesthetics is actually where people go when they see the signs of aging. And what we do is we treat the surface quite well. And that matters. It's really important. But wouldn't it be amazing if there was a way to capture that whole complex human and elevate them on all the other planes simultaneously? And that's what I'm hoping to do next. My situation is very different because I have a training school and an aesthetics clinic and the online platform, and the clinic is an hour and 10 minutes away. I don't know when this will come out, but we are now changing things around, and we're going to double down in one building and pull everything together there, and try and document everything. We'll try and make a sort of mini documentary of everything that we do. But I have although I've been personally very interested in it, and I've talked to patients about it all the time when I see them. I'm doing the first kind of solved longevity consultation on the 12th of December. So we'll see how that goes. But I'm attempting. It's going to be really in depth and long, and I want to capture tons of information. We'll use some AI to package it and then produce. I'm really keen, like I mentioned before we started, I think, that to produce a plan that people can actually execute on, because the hardest thing, it's very hard. I mean, even just me doing this podcast today has changed my whole system. Like, I'm no longer taking the kids to school. Then my wife's doing something different. It's only a tiny thing, but it's changed my whole day. And that's what happens when you say, don't eat junk food. Suddenly the whole system changes. Like, they don't know where to shop, they don't know what to eat, they don't know what to do when they feel hungry. And there needs to be help with people to make changes in a sustainable way. And I think that's actually the biggest barrier with longevity, is getting sustainable changes. So I'm going to focus a lot on that when we start to actually implement changes, because knowing what to do, the information is already there. It's actually changing it. And then, of course, we have the bigger barrier of how do you do that without taking a very valuable clinician and having them spend many hours doing it. So we need coaches and information and apps and various things. But anyway, that's kind of broadly where I'm at the moment.
And where do you think there's going to end up being a marriage of longevity and aesthetics moving forward? Do you think clinics are going to embrace this side of medicine?
So I think the marriage will happen in the brain of the clinician first. It won't happen in the minds of patients until they meet that clinician. Because people are super visual. They're semi-conscious about, I mean, I include myself in this, but not in the area I'm specialist in. We are semi-conscious about why we do most things. And you need a clinician to help you understand that the reason that you want your wrinkles to get rid of, or you want fuller cheeks, is because you want to connect with other humans, build relationships, and that ultimately is linked to your longevity. Like, very clearly, there's plenty of evidence to say relationships are important. And we know that appearance is very important in relationships. So if you can get your patients to understand that, then they will see the context. The other thing that happens if you're very good at longevity is you start to lose volume. And I don't know if you followed Brian Johnson, but it was interesting seeing him do very well on a physiological level and then start to look strange, and then have aesthetic treatment to balance things out. So that's and the reason, his justification is exactly what I say, which is you need to, if people are talking to you but all they're thinking is, gosh, you look weird, or you look strange, or you've got no cheeks, or whatever it is, you're not connecting with people. So it is part of the same puzzle to solve, that you make people look healthy, so that they can get their appearance just to act as a something that helps them connect rather than as a barrier to connection. So it will become, for many people, part of the same package. But I think the average person who is broadly okay with their appearance will, and there are many people, I live with my dad at the moment, who's never even asked anything about anti-aging treatments. He doesn't care. He's a man, he's in his 70s, okay with those things, but he's interested in the health side. So there will be those patients who never cross over, but there will be a lot of people, and it will be more women than men, because I think they're not necessarily judged differently. Their appearance serves a different purpose evolutionarily, and so they will pursue things differently, as they always have, than some men, than the majority of men. But it should start to feel like one problem that you're solving, which is how to make a happy, healthy human, and some of that is appearance. And as long as you're aiming for that happy, healthy human, you'll solve many problems along the way.
Tim, what do you think about the women? I'm sure that you guys have the same patients at times that I have, who feel quite guilty. So they will come in, and there may be, maybe a mum who hasn't really put herself first for years, and then they've perhaps gone through menopause and really felt like they've suddenly aged, but they're almost apologetic because they still feel a lot of guilt, that they feel like they want to look nice, they want to look better, they don't want to age, they don't recognize themselves in the mirror anymore, but they almost feel guilty that they shouldn't care and that it makes them superficial, or it makes them a shallow person because they care about this. But what would you say to anyone listening who has that kind of barrier in their mind?
So the best thing I say is actually more about questions. I want to know the context of their life and their treatment. The first patient I ever saw was relatively young, had a young child that didn't have the best clothes on. I remember thinking, should she be spending the money on this? So I had a little bit of that judgment in it, and I thought about her quite a lot as well. And she was working in a pub. She was front facing, but she was also single at that time. I remember over time thinking, who am I to say that her looking after her appearance is not going to lead to an interaction that then leads to a new relationship and a new life? Because, if you're young and you've got a single mum, meeting the right person can make the world of difference to you. So I always try to look at people in that context, but I don't think patients do that. So I would ask them questions that would help them realize that this isn't just about your appearance. Because tell me how you feel. I often use good hair days. How do you feel on a good hair day when everything's on point? What kind of person are you on those days? Do you smile more? Do you feel like you can pay more attention to your children because you're less stressed out? And you'll find that people, maybe if they've never looked after themselves, they may not know it. But basically, when you feel taken care of, you immediately stop thinking about yourself and you start to think more about other people. And they actually do more looking after of other people in a way that's freer and easier. And that's usually what comes out of it if you get them to pay close attention. Now, it won't be true with every person, but the average mum who has looked after herself will look after her children, certainly in a freer and easier way, because they're less stressed out. So, and then if you ask them to pay attention to that, they will also observe it. And that's usually the end of it, when they say, you know what, I felt great. I remember going to my kids' school thing, feeling really confident, whooping when they were on stage or whatever, and whatever it was that they could put more of themselves into the world. Because that's really another way I describe it, is we want you to put more of yourself into the world. And that's a good thing for the world, because you're trying to do good work and look after your kids. So that's how aesthetics tends to work, when done on the right person correctly, is that they feel more able to project themselves into life, including their kids.
Yeah, I agree. And I think the other flip side of it as well is, unfortunately, in medicine, I think there can still be quite a bit of snobbery in medicine, that aesthetics isn't real medicine, and that we're not sort of saving lives and all that kind of stuff. And it all feeds into the psyche of everyone feeling like it's all a bit like embarrassing or whatever. So I just think it's very interesting how the clinician can be made to feel one way, and the patient can be made to feel guilty for actually wanting to care about what they look like, that in some way it's making them superficial. But I agree 100%. I know that whenever I've had my hair done, I can conquer the world.
That's the heart of the deepest philosophical debate in this whole sector is your appearance part of your health? And I think it's really obvious if you pay attention and you consider that health is not biological failure. It's not like you're a heart attack or a clot in your heart that stops you from living. It's the fact that you hold yourself back psychologically and people are distracted by the blemish or whatever it is, and that stops you forming healthy relationships that you could form. So as long as you start to see health as both psychological and social and not just biological, then aesthetics is very clearly part of health. But almost no one in that highly technical field, if you're a brain surgeon, you just may not think that way, and you need someone to explain it to you differently. But this is why I would rather we start to think of ourselves as experts on human connection rather than experts on what people look like, because that's what people look like as a tool for connection. And if you start to think of it that way, maybe even rebrand it one day, I don't know, then maybe more people would understand that what it really is, because it isn't about how you look, it's about how you feel and connect, how you're received. It's different.
Yeah, absolutely. And like you said, the patient who's recently divorced and has gone through their heartache and kind of coming out the other side, they are ready to have a bit of confidence to go and conquer the world and maybe go on that date that they've been putting off. So I think it can be really transformative. Tim, where do you think aesthetics is going to be in 5 years' time? Like, what do you think we'll be doing differently? Like, will AI be involved in the assessments? Or I know that you're very cutting edge in your thinking. So where do you think we're going to be next?
There will definitely be AI involved in assessments. I mean, eventually AI will be doing everything, I suppose, but including the procedures, because you can easily, they've already got computer machines doing brain surgery. So you just need to gather the data, and they will be doing that sort of thing as well. I don't know how good that will be, because it could strip out all the humanity from it. I think the thing which I hope happens is exactly what we've been talking about, which it starts to be seen as a branch of looking after your overall health rather than this tangential, risky thing that's nothing to do with health. That's actually quite dangerous, which is how people see it. So that would be the best thing that could happen, is that we start to see it in that more holistic way. And there are many practitioners who already do that, so that's kind of happening. I think there's going to be increasingly amounts of attention on the sort of cellular function level of things, linking it to longevity as well. But it's, how do you make the skin healthier? And more people will be pursuing that than the more superficial or temporary fixes, which is also good. And we will also probably have more of the bad stuff as well, because they always seem to go together. So more extremes, more things that aren't true, that are relatively risky and dangerous. Because I don't think we're going to get away from the fact that, especially with the digital world, people are more hungry than ever to keep up with basically things that aren't even possible. Air filtered images, and so. But at least we talk about that now. At least there's a conversation around that. So I'm ever an optimist. I think you'll get better. I think we'll get more powerful. I think we'll get better at describing it in a better philosophical way. And in the long arc of time, the good guys will win. So that's what I think.
Here's hoping. And if you had someone listening who'd never ever pursued treatment before, what would you say that they should look out for in a clinic or a practitioner that they're going to see, and what would be a red flag for you?
The main thing is to really read the words in the reviews. It's very easy to get patients to put a 5-star review on, or to get a bot to put a 5-star review on. I know this happens with clinics around the corner from me, because I always look at people's reviews when I hear stuff through the network of clinicians. And there's one clinician who's just constantly got terrible things being said about her by the network of other clinicians. And then when I look at the reviews, it's all 5-star reviews. And for ages, I thought, oh, they're just jealous. Then I started to read the reviews and see that those reviews had not left any other reviews. Or if they had, there's like one-word things. And the negative reviews, which were also numerous, were just outbalanced by all these 5-star, very simple reviews. And I was like, oh my God, these are fake. And you read the wording of the negative review, there's an essay. And then all the others are this superficial, it's just, yeah, great, love them, love my results. And I was like, oh my God, it's fake. And I didn't really, because I'd never think to fake a Google review. I always assumed that Google's so clever that they would figure out who did it. But anyway, clearly that's not the case. So read the wording and look for there are 3 branches that you need to look for, which is the person competent, which you can tell by their qualifications to a degree, but more so by the way they solve problems. So it's more of a consultation-led thing. So if you come to a good clinician, you say, I've got this problem with X, Y, or Z, or I'd like Botox, but I'm afraid of it, and they don't kind of brainstorm with you and try and solve the problem in a way that fits you, then they're just lacking a bit of that clinical decision making that might make them better. They'd still be safe, I'm sure, but there's competence, so qualifications and skills that you can see. Before and afters could be part of that. I know you guys can't share them, but it's you're looking for someone who can solve problems. Then you've got integrity. So do they sound like they're solving the problem that you want them to solve, or are they solving their own financial problem? Because that's often they're actually playing 2 different games, and a clinician should be trying to optimize for health. But obviously it's quite easy for clinicians to be optimizing for finances as well. And we're very good at picking that up. Most people can tell, but I'd pay attention to that. And then the final one's the most subtle, which is emotional safety. Like, how does this clinician make their patients feel comfortable and listened to? Do they fob them off, or do they answer them in detail? And you can normally, when you read enough reviews, you can see that they're confident, they're keeping them safe, and they have integrity. And then I don't know if they'll be the world's A-star like artist who's a wizard with a syringe or not, but actually for most patients that matters less than is this person going to really look after them no matter what and respond to their needs, because you can do a lot and be 7 out of 10 at the artistry and still have very happy, healthy patients. And most of the very artistic stuff you see online is photoshopped or photography related. And so they're angling stuff, and the same patient 2 seconds later in a different pose does not look anywhere near as hot. And that's why I care less about before and afters from a clinical perspective. I care more about the reviews the patients leave.
Yeah, absolutely. What would you like to see change in the aesthetics industry?
Yeah, it would be nice if, I think I'm probably going to go back to the same thing. I'd like the philosophical shift of saying, it's not really about appearance, it's about health. I would like, if I'd looked at it from a patient perspective, it would be nice if patients were researching we're looking for deeper things, and I'd love the word to get out that it's not just about your appearance, it's about your function. So I think I probably said that enough times. Within our industry, I noticed recently at a conference that with Dr. Subia, he's quite cutting online with how he challenges people, which is fine. It's not always easy to read if you're holding an idea he doesn't like, but in person, incredibly gentle and very unlikely to upset anyone. And I wasn't quite expecting it the way it played out. But actually, I think we need both. I think we need love and boundaries. I would say love and boundaries, best advice you can ever get for patients, children, relationships. But the love has to come first. So some people lay the boundaries first and they criticize people, which is, I think, how it comes across online. So it comes out as critical. And then in reality, they're all the love, but there's no mention of that stuff. And I think we need to get better at doing both. I would love people to be able to have conversations like, if I said to you, Shauna, I love you, I love what you're doing, but I think you're wrong about something, and I told you what that is, that's a gift. And I don't think we do that very much. I think what we do is, that's Shauna, she's wrong about stuff, not realizing that Shauna's trying her best to be right. And just like all humans, she's made a small mistake. And it would be great if our culture shifted to, I love you, but I think you're wrong, rather than I think you're an idiot for being wrong. Or I love you and I'm not going to tell you when you're wrong. I think that would make everything a lot better in aesthetics.
Yeah, absolutely. And maybe everybody would not be quite so much in a little silo by themselves. And there's obviously some new advancements. I'm not sure in the UK, have you guys got exosomes and Redurin and those type of things?
Yes. Yeah, we have those sort of things. They seem very popular with clinicians, especially. They're polynucleotides, most popular new thing in our clinic. I'll be honest, I love the idea behind them, but I think they're being used in places where the old stuff is better, because they're new and exciting and everyone wants to use them. And there could be I think like a lot of things, there's going to be a surge of popularity and then a drop in popularity, and then it'll emerge somewhere in the middle as a useful adjunct for many situations, but it's not a replacement for tear trough filler, for example, which everyone is now using them as it's just solving skin quality. It's not going to solve a shadow or lost fat pad. So there's a bit of that going on with all these things, but they are tremendously exciting, and who knows what's going to happen next. And as I said, I think the real holy grail is reprogramming the cell to behave like a younger cell. And if you can do that, you're going to solve 80% of the problems, if not more, quite quickly. So the trend in that direction is fantastic. The effectiveness and the over-enthusiasm will balance itself out. And I don't think it's the end of the world, because it's not like, at least it's not like filler where you can overdo it. It's not going to make anyone look worse. What about you? Do you have that in Australia yet?
Yeah, we do. And the other thing I was going to ask you about was, did you have any thoughts on using topical estrogen, like estriol cream or anything? Is that something that you guys have over there at the minute?
Yes, I don't know if we have it, but I was reading about it, and it makes sense that it would work. I mean, one thing I've learned about menopause is every cell of your body has these estrogen receptors on it, and it would make perfect sense that if you that that estrogen cream would be one of the things that would help you look better. I'm not in touch with kind of the big data or evidence base behind it, but from a first principles perspective, it makes sense. And I can tell you from watching Randa that these creams do work.
And in terms of like hormones, would you recommend patients if they come to see you? So let's say you have a peri or postmenopausal woman with very poor skin quality and impaired barrier, do you perhaps encourage them to go and have a conversation with their doctor about hormone replacement therapy in the context of obviously overall health, but potentially with its impact on skin as well?
It's a great segue into it, I suppose. I think the thing, so I would ask them questions to explore the whole menopause thing and what their feelings are around hormones. Some people have had bad experiences with them and they don't want them. There are not that many of them, but mostly it's the opposite in the UK, which is they don't even think about it. They just think it's a stage you go through. And so, yeah, I think we should be, as clinicians, you should be looking for opportunities to talk. This is the big change, which is how do you take that appearance, a diagnosis, and turn it into a more holistic diagnosis, which hormones would be a big part of that. So yeah, we absolutely should be introducing hormones as an idea for patients who are presenting with appearance-related issues.
Yeah, amazing. I've got one last question for you, which is something I ask everyone who comes on my podcast. If you could talk to 20-something-year-old Tim, what piece of advice would you give him?
I think the biggest shift for me is, I think a lot of my life I was asking for what I thought was I could have, not what I actually wanted. And I'm pulling it together now, hopefully not near the end, but later on, which is there's a lot of, I give you a silly example, which is our initial business model was to go around other people's clinics and venues, and we did very well. We got like 100 of them, but then I had a business that I hated because I was all over the place. What did I really want? I wanted to have a business around the corner from me. But why didn't I build that? Because I thought I had to do the other thing in order to survive. And now I've learned that, because basically all it does is it forces you to innovate. I was copying someone else's business model and took it to the extreme. Whereas the best thing in life is to figure out how to express yourself through your business and to build a business that actually helps you, that actually meets all your needs. And because then you'll also meet other people's needs better. So now I have a studio that's 10 minutes down the road, and we're now moving everything into that. And I'm going to make tons of content and share all the information with our audience and with our, and we know how to build a business that way, and it's going to be tremendous fun. I was talking to a friend of mine who was last night, and he was talking around retirement. I was like, why would I retire? That's so exciting. And I never think about retirement. I just think about what I'm going to build and what I'll do next. And I'll be very sad the day that stops. But the point is, my advice would be, ask for what you really want and don't be bashful about it. Just ask for what you want instead of what you think you have to do in order to be successful. It's a very hard question. Most people don't really get to the heart of what they actually want because they do what they think they need to do.
I'm going to sneak in one, like a part B to that question, which is I think about a year ago, I saw you going off to Richard Branson's island on, is it Necker? Is that what his island's called? Can you give us one little tiny bit of information of what you learned?
There's lots of things. So there's several really important takeaways for me. The first is he said to me, a lot of people come to this island expecting business advice, but really I just think they just need to go and do it. And it's a very weird situation. If you're on Necker Island, I never met Richard Branson. Had like a fight. He's super kind. Like this, he's like your granddad that you wish you'd had, kind of thing. And that's the first thing he says to me. And I just couldn't stop thinking about it. It's actually profoundly good advice, because so many people are waiting for someone to tell them what to do so they don't make a mistake. But actually the truth is you have to make the mistakes and stop waiting until it feels right, and just go and start your first ugly version and then get the learning and do the next thing. Just go and do it. And it sounds like really dumb advice on a superficial level, but when it's given to you by Richard Branson, it suddenly takes on this whole new meaning.
Yeah, absolutely. Better done than perfect kind of thing.
Yeah, just start moving in the direction that you want to go in, whatever that is, and you'll figure out stuff on the way. And you might even change course, but at least you're going in that direction. So just go and do it is actually quite good advice, I think. The other thing that really struck me was there's two other things. So the first one was this was around his brand. So I used to think about branding as a thing that people come up with. It's like a set of ideas that you think, oh, let's make a brand to appeal to teenagers. And someone goes into an office and draws a diagram and comes out with a brand for teenagers. And actually, that's not what the Virgin brand is. When you hung around with him and they talked about the Virgin values and the brand, I was like, it's just an expression of his personality. That's exactly him. He's spontaneous. Like every time you leave Necker Island, like he'll do some crazy flip into the sea or whatever. And he does spontaneous things all the time. He stands at all the tables on Necker Island are built to dance on. They're all really strong. So, he's, and when I heard of the Virgin values, I was like, I realized what's actually happened here, which is he's built a system to get his spirit out through a brand. And actually, I think that's what most clinicians need to do. I think you need to figure out what you care about, what you're passionate about, and then start to put that out into your graphic designs so that people can feel it. And that's really what a brand is. It's a feeling you create in people. It's not a logo. Feeling is an authentic thing. So you need to put it out in a way that is a true expression of yourself and things you really care about. And I think it resonates better. Yeah, the final thing is I realized on that island, I was also with Dr. Felix Bertram, who's got a huge clinic in Switzerland. It's tens of millions he turns over. And the two of them together with some discussions, I realized that the mindset when I started my business was, I'm going to grow a business and hire people to fill in the gaps where I can't do it anymore. So you get a receptionist because I used to go out and get all the patient in. I can't do that anymore. So I'm building a team to help me get busier and busier. Whereas what both of them did is they built a team who then built the business. So if you want to grow a great practice, you need to hire people who will build a great practice for you, not try and build a great practice with some help, because there's too much pressure on one person, you become the bottleneck of everything. And so because of that, we started hiring much more expensive people, and they are much better at their jobs. And more than that, they're better than me, which is the best thing. So basically in my business up until 2 years ago, we were all at the leading edge of what we knew, like the bleeding edge. Like no one knew more than me about, how to describe a product or how to consult a patient or how to do an injection. No one knew more than Miranda about marketing. No one knew more than the videographer who we trained up on ads, like how to create an ad and now we've hired a whole bunch of people who know more than that on all of us. Maybe not the clinical side yet, but we're working on that. And it's so much more fun and easy because they're like, oh, there's a better way to do that. Oh, I've got a much higher goal than you've got. I mean, Mark, who does our marketing now, he's always like, why aren't you pushing for twice that much? I'm like, I don't know. I don't know what's possible. I've never done this before, Mark. It's like, well, I'll do it then. So, get a team who are better than you where you can. And see what happens, because I think it's one of the biggest differences between mediocre and great businesses is that the team becomes the most important asset, and you're constantly building and making sure the team is happy and then protecting that. That's the other thing. Rich is also very clear on his company culture is super important, and I know this from my experience with my clinic. I wasn't very good at guarding company culture. I hire great, nice people, but you can't use every now and then one gets through the door, a narcissist or someone who's there for themselves, not for the team. And I had an amazing team, and it was basically destroyed within a couple of years because I wasn't firing people, and it became miserable. I used to sit outside work depressed, not wanting to go into the building because I had all these problems with the team. And that was just me not having figured out how important it is. And now we will fire people if they're not a cultural fit. They might be amazing at their job, but if they're not making the team feel great about coming to work, they have to go. And that was the other really important thing.
Amazing. Tim, thank you so much. You've been so generous with your knowledge. I could pick your brain for hours, but I know that you've got other things to do. So thank you so much.
It's been a pleasure. It's great to connect with you. It's always good to talk about yourself as well. So it's a pleasure.
When I started this podcast back in December 23, I knew that I was lucky enough to have amazing conversations with various health professionals across all facets of medicine and allied health. And I knew that you would probably really enjoy being a fly on the wall to hear what we talked about. And that's how the podcast was born. And what you probably don't know is that this is a bit of a passion project. We don't have any sponsors or funding. And without your help, we won't be able to continue bringing you these great guests. So if you can please spread the word about the podcast, share it with someone who you think might benefit from the conversation that you've just listened to, or if you can leave us a review or a comment, it would mean the absolute world, because that actually helps the podcast spread further and get more people to hear our message and hopefully allow us to invite bigger and bigger guests onto the show. And I would so appreciate you helping me back. Thank you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.